does this case resonate in the type of patients you see in your practice in Philadelphia?
Unfortunately, Mark, this is a pretty common occurrence, and we have patients essentially presenting late for medical care. And so I think some important parts, to the epidemiology of hepatitis C are really highlighted in this question. The first thing is that this patient had genotype 1 infection, which in the interferon era was pretty difficult to eradicate, and I know we'll talk a little bit more about that. And many African American patients had contraindications to treatment. We'll also talk about that. For many reasons, many African American patients were not treated for their chronic hepatitis C infection, and for those patients with a history of cirrhosis were also not entered into a hepatocellular carcinoma surveillance program. And unfortunately, we're kind of seeing the end result of, number one, not undergoing treatment of hepatitis C infection, so lack of eradication, and really this patient being at risk for going on to develop those adverse health outcomes associated with hep C, so cirrhosis and liver cancer.